And welcome back to Talk of Alabama. Spring break is right around the corner, and if you are foregoing the beach this year to hit the slopes, you are in luck. We've got Dr. Sam Goldstein here with Andrews Sports Medicine and Orthopedic Center to give us some skiing and snowboarding safety tips. Welcome to you, Doctor.
Thank you.
Well, it's pretty common. A lot of families this time of year or spring break, they head to Aspen or somewhere where they can do a little bit of this activity. Do you see a lot of injuries or hear about a lot of injuries?
Oh, we do. We see, quite a few injuries from people that have, traveled out for their break and come back with something that needs to be taken care of.
What are some, for those at home watching right now, just some general injury prevention tips we should all be aware of?
Well, the important thing is that skiing is a sport that requires, a lot of strength and conditioning.
Okay.
Before you go skiing, you need to start on these programs. It's not good enough to start a week ahead of time. Cardiovascular activities, whether it's jogging or treadmill or elliptical training, anything that will help your cardiovascular fitness is very important for these sports because most of them occur at altitude. Secondly, flexibility exercises. You need to be able to do balance exercises, single leg exercises, so that you're ready for the changes in terrain and the changes in what happens as you're on the slope, sometimes predictable, sometimes not. I know one of your staff here had an injury or an incident where another skier ran across their snowboard, and those are the kinds of things we see, so you have to be able to react
fast. What about, you mentioned altitude, interesting point. I guess a lot of people don't even think about that when they're planning these trips, right?
Right. If you're going out west, typically you're going to be at a mile high or much greater than a mile high. The tops of these ski areas are anywhere from 10 to 11,000 feet above sea level, so that's 2 miles higher than what we are here.
Wow.
So the oxygen is much thinner. It's certainly not Mount Everest, but you do have to be ready for the decreased altitude. So altitude sickness is something that can be fatal. So we can't really acclimate coming from 500 or 600 feet above sea level to sleeping at 9,000 feet above sea level. So you get ready for this by the conditioning, but you also get ready by hydrating for several days before you leave.
Okay.
Hydrating on the way out. I tell people when they're going skiing, make sure they take a bottle of water and drink it on the plane. When you get there, you need to remain hydrated. You need to avoid alcohol for your first few days, which is difficult for a lot of people because they're on vacation. But those are the things that typically will bring on mountain sickness or altitude sickness.
Okay, what about the proper equipment? Because a lot of times, if you're just going for spring break, you might rent equipment or borrow equipment. Is that a bad idea?
Well, borrowing equipment probably is a bad idea unless you know how to set this equipment up.
Okay.
Especially skis and boots, they have to be matched with your weight and your ability and your height so that your bindings will release appropriately if you do get a twisting injury. Snowboard equipment, again, it has to be fitted. It is something that each individual needs a certain type of board and a certain type of equipment to successfully get back from a trip without having to see us.
Well, you talk about that. Common injuries when it comes to snowboarding and skiing. I mean, I think I would straight up kill myself because I'm so clumsy walking. I can't imagine myself on skis. But people that actually do this, what do you see when people come in? Is it broken wrist? Is it sprains? What is it?
It's a little bit of everything. Skiing, the thing that we think of the most is ligament injuries like ACL injuries or other ligament injuries about the knee because you have a long board attached to your foot that is going to get a torque or a twist, and that tends to lead to those ligament type injuries. But with the fall, especially with snowboarding, there's a lot of upper extremity injuries. We'll see wrist injuries, shoulder dislocations, shoulder fractures, shoulder separations, which is a slighter ligament injury in the shoulder.
Yeah.
But those are the typical types of things that we'll see with these activities.
Okay, how can people get more information if they want to talk to you or visit Andrews Sports Medicine?
Well, we have our website, andrewsportsmedicine.com.
Okay.
And our phone number, 205-939-3699. But we do website and our Facebook page have a lot of information on these types of activities.
Okay, if it's something minor and you get hurt, then you could probably get it treated wherever you're vacationing. But if it's something big, then you want to come back here to Andrews Sports Medicine and have these guys work on you. Thank you so much for being here, Doctor.
Thank you.
We appreciate your time. Don't go anywhere. Talk of Alabama will be right back in a moment. You're watching ABC 3340. Please stay with us.